Yes, we're live. Hi. Welcome to. Why is that showing there? Oh, connection is unstable. Let me see what's happening. Where's my phone? Welcome to the stream. I hope you guys can hear me okay. Let me just check the sound. I've not seen that sign before saying connection is unstable. So let me just check that you can hear me. Otherwise, I'm just going to start a fresh one. Welcome, guys. Oh, I'm so glad it's the weekend. I hope you guys have a nice weekend planned, restful weekend. Today we're talking about fibroid myths. Fibroid myths. So yeah, we're talking about fibroid myths, and we're going to address some of the common. Is it playing? Hang on. Yeah, we're talking about fibroid. There we go. Yes, it is playing. Fantastic. So this is what we're doing today. Let me just turn this out. I hope you're well. Guys, we're talking about fibroid myths because there's so many different things that we hear out there that can affect how people think about fibroids, the symptoms, how soon they come to doctors for treatment and all that. So this is why I wanted us to have this discussion. Plus, I'm going to leave this live stream open, I think, for about an hour, and I'm taking any questions around fibroids. It doesn't have to be a myth, but it could be just related to fibroids, some information that you want to clarify, that's fine. But I've got a few myths I wanted to go through with us today. If you're just joining, hi, thank you so much for joining the stream. Please don't forget to give this video a like, and of course to share it with somebody, share it with your network and people that you think might find it useful. So let's just jump into the first one. Oh, before we do that, there is an interesting question. I've not really answered it yet on my on the comment section, but somebody asked me about matcha tea. Where is it? I said I was going to, yeah. So it says, is matcha green tea preferable than regular tea? Can I drink it once a day for anemia? So the only difference now, okay, first, I do have 1 or 2 videos about this. I talk about using green tea because there is some evidence that using green tea with vitamin D has been shown to help some symptoms of fibroids, and it even goes as far as suggesting it could help to shrink fibroids. So there's some studies that talk about this. So that's not an issue. Matcha green tea is powdered green tea, which is different from green tea leaves. So the main difference between the two, if you hear matcha green tea is powdered, and the main difference is that it's more concentrated. So it's got more concentrated quantity of caffeine and all the other antioxidants that would make green tea effective. So if the question is whether matcha green tea is preferable, well, you would certainly get a higher quantity of things like the EGCG. EGCG is that active antioxidant, anti-inflammatory component in green tea, which scientists believe is responsible for a lot of the work that green tea does and for its work in fibroids. So please go and have a look at that video of mine. I might put the link after the video, after we finish this live stream, if you want to watch that video, because I talk about the research and what they found, what types of fibroids they felt it worked better on. So it's a good video to watch. But yeah, matcha green tea can be used instead of green tea, regular green tea. I don't know by how much more it will be better than normal green tea leaves that you just put in water and steep. But because it contains a higher quantity, there is an argument that it could be better or maybe work a bit faster. I don't have the facts and figures for that. But if you're taking green tea, there is some evidence that it could help with some types of fibroids. So that's that question. Now, if you're watching the stream, thank you so much. Please don't forget to give it a like. And if you've got any questions, please pop them in the comment section for me. Be happy to take a look at them for you. We are coming to the end of Fibroids Awareness Month, and it's been a roller coaster because I promised myself I'll get out a video every day for the whole of the month, which I've done as much as possible. But yes, we have a few more days and then Fibroids Awareness Month is gone. But I hope that if you've been a regular visitor to this channel, you have gained from the different bits of information we've shared. I didn't want to put everything in one video because there's so many questions around fibroids. There's so many things to think about. So I put them in separate videos, and I hope that it's helpful to whoever needs to get that information. So we're talking about myths. The first one is that fibroids are caused by an unhealthy lifestyle. So there's this idea that women who develop fibroids will do so because of an unhealthy lifestyle. So let's think about this. As you know, quick introduction, please. I'm assuming that everybody knows what fibroids are, but for somebody who has never heard of it or doesn't know what it is, fibroids are benign, that is, they're not cancerous growths in the womb, in the muscle of the womb. It's actually the most common type of gynecological tumor, that is abnormal growth in women. So that's what fibroids are, and they can affect women at different ages, particularly within the childbearing age, and they can cause a range of different symptoms. But interestingly, the type of symptoms they cause can differ from one woman to the next. So those are what fibroids are generally. We don't know exactly what causes fibroids, which is what's bringing me to this particular myth about unhealthy lifestyle. We don't know exactly what causes fibroids, but we know it's associated with hormone imbalance. Estrogen is a culprit when we talk about fibroids. We know it's associated with age. We know it's associated with your genes. We know that your diet can be relevant. So in terms of excessive amounts of red meat or beef, alcohol, caffeine, some types of dairy, you'll hear about milk, and you'll hear about soybean. The evidence there is conflicting. So some studies suggest that excess amounts of milk can contribute to fibroids. Other studies suggest that vitamin D, low vitamin D, contributes to developing fibroids. So there's a bit of we're not very sure which is it. We still need more studies. Okay, so there is an argument that an unhealthy lifestyle can contribute to the development and growth of fibroids. And by unhealthy, I mean things like excess amounts of saturated fats and excess amount of sugar, because high sugar level is also associated with fibroids growth. So there is an argument that it has some responsibility with fibroids developing. But because we don't know the exact cause, you can't blame an unhealthy lifestyle alone on fibroids, okay? Because even though some types of diet, like I've mentioned, can affect how the fibroids grow, being overweight as well can also affect how the fibroids grow. The fibroids themselves are mainly, we think, influenced by the hormones and the genes. So you can't say that an unhealthy lifestyle alone is why you have fibroids. There are many women that have fibroids on both sides of the spectrum, the ones that are very overweight and the ones that are very slim. So if you wanted to blame an unhealthy lifestyle, perhaps in somebody who is overweight, how do you explain very slim, fit women with healthy lifestyle? How do you explain them having fibroids? So let's bust that first myth. That's not correct to say that an unhealthy lifestyle causes fibroids. Thank you so much for joining the stream. And if you're watching this live, please like the video. If you're watching on the replay, let me know what your thoughts are. Any myths you've come across about fibroids, any questions around fibroids, happy to take them from you, but please give the video a like. Number 2 is the myth that fibroids only affect older women. So like I said in the beginning, fibroids can affect women at different ages. And do you know, yesterday's video, was it yesterday? Yeah. Thursday's video was actually, let's see if I can share my screen because I do have it up. It's actually effect of fibroids on different age groups. So I'm sharing my screen here and just pointing your attention to this particular video, who has fibroids. So if you've not watched it yet and you're interested, please head over and check out that video, who has fibroids, who gets fibroids, because that video is looking at how fibroids affect women at different stages in life, starting with puberty and adolescence, then going on to your early 20s and 30s reproductive years, then going into perimenopause from your sort of early to mid 40s, and then after menopause. We used to think that fibroids is a thing of sort of older women, but actually fibroids can affect women at any of these ages. Of course, it's less common in around adolescent or teenage girls, is less common, but it can happen. It just tends to be more common in women who are a bit older. So as they go into their reproductive years, around perimenopause, that's when it tends to be common. for a lot of women, their fibroids actually shrink as they go into menopause. They stop having problems with as they get into menopause. But we can no longer say that, oh, your fibroids will get better once you get into the menopause, because to be honest, we don't know that for certain for every woman. There are many women who have gone into menopause, past menopause, but still have fibroids that are giving them problem. Maybe the fibroid is big, it hasn't shrunk, so it's putting pressure on their organs like the bladder, or it might still be bleeding. So that assumption, that myth that fibroids only affect older women, that is wrong. It can affect women from all ages, from late teens to menopause, even though they are common, more common in women in their 30s and 40s. Okay, so that's myth number 2. Let's go on to myth number 3. Thank you so much for joining the stream. Happy to have you here. Please give this video a like and, of course, subscribe to the channel. I'm doing an on-camera stream today. Last 2 have been off camera because it's just been so busy. I've not had the time to get the glam look on. But good to have you here. So myth number 3, and I know your ears are going to prick open for this, is that natural treatments can completely shrink fibroids. I'd love to know what you guys think, because there are lots of natural treatments out there that say that they can treat shrink fibroids. Haven't got any problem as a medical practitioner with natural treatments for fibroids. I just want us to be clear on what they are doing in the body. Many of them claim they're able to completely shrink the fibroid and get rid of it completely, which is where I quarrel, because we don't have the evidence that they can do that. They can help with some symptoms. I was talking about green tea at the beginning and referring you to that study where it was saying that it was able to shrink. I think it said it shrunk by about 20% or so. It's a good video to watch because I have all those details, and I have the link to the study is also in the description for that video. So that's one study. We still need a lot more to say to show us that this effect or this natural method actually provides a cure that is completely removes the fibroids. We don't have anything like that yet. Even medical treatments, there's no medical treatment that completely removes the fibroids. The solution to that, which we have at the moment, the options that we have are a myomectomy or uterine fibroid embolization or the MRI guided focused ultrasound or hysterectomy. And of course, I've got videos on that. Even in the last couple of weeks, I have got videos talking about these methods. And those carry their own risks and side effects. They're not the ideal cure per se, but in terms of removing the problem compared to natural treatments, as far as we know. Now, I'm not going to quarrel with you if you have some personal story, because some ladies will say, well, I lost weight, I did this, I did that, I used green tea, I stopped eating certain types of food like red meat, I cut out milk from my diet, and so on and so forth, and I saw a difference in my fibroids. I'm not going to take that away from you, because we do have some indication that they can help. They can certainly help with your overall well-being. Losing weight, of course, that would help. Exercise, of course, that would help. And even a greater bonus if it takes care of very heavy bleeding that fibroids can cause, or it helps with the bulk that fibroids can cause. The issue is that we don't have any evidence that they actually shrink and completely remove, especially big fibroids. So that myth that natural treatments can shrink fibroids, even though there is some remedies like supplements, castor oil packs, yoga, these are natural methods that can provide good symptom control to many women with fibroids. The issue is to say that they will completely shrink them. So you can use them, just be realistic. Let's be practical about what they are doing in the body. And I know some people might say, well, what's the difference between getting rid of symptoms and removing the fibroids? Well, it depends on the woman. Remember, everyone's story is individual. You might find somebody at the age of 50 with fibroids. Her challenge might be that the fibroids are causing horrendous bleeding. She may have 1 or 2 or more fibroids, compared to somebody who is in that. And this 50-year-old lady, maybe she's got kids, and then you have 20-something-year-old lady who might just have 1 fibroid. It's not causing bleeding or anything, but it's sitting in a not very good parts of the womb, and so maybe affecting her fertility, as some fibroids can. I had a very interesting discussion with my colleague, Dr. Tolu, from at vulva.doc on Instagram, and she shared with us insights on how fibroids can affect fertility. This same Fibroids Awareness Month. So please go and check out the playlist. I'll put the link for you in the description box to hear the current thinking and the real facts about how fertility and fibroids interact. So that was myth number 3, guys. We're talking about fibroid myths. And I'm asking for any questions. I'm happy to keep the stream open for a bit longer than usual. If you've got any questions, we can talk about them related to fibroids. Okay, so yeah, so that was myth number 3. I'm just looking at my list. So number 4 that I want us to address here is the myth that surgery is the only option for treating fibroids. So this is one that people use to scare women, in my opinion. You know, when women hear, oh, fibroid, that fibroid diagnosis, the mind automatically goes to, oh, I'm going to lose my womb. And I think that's such a horrible, horrible thing to say to for a woman to feel. And the connotation, so particularly for Africans, Afro-Caribbeans, African-Americans, and I use us as an example because for some reason that we're still not sure about, we tend to have a higher incidence of fibroids amongst different ethnic groups. And of course, culturally, childbearing, I'm not saying childbearing is not important in other ethnic groups, please don't get me wrong. But in terms of the connotation and womanhood and childbearing and fertility and how closely linked these things are in our minds, a lot of our societies still remain quite patriarchal and can be very, very tough for women. I explored the emotional impact of fibroids again in Fibroids Awareness Month, and I would love you to go and check out that video as well. And I think it will be useful for us as both doctors, nurses, and people, women with fibroids alike, to open up about the impact, the mental health and emotional impact of fibroids, gain support from partners, because it can take such a toll. It can take a toll in terms of experiencing the symptoms like heavy bleeding. It can take a toll like pressure symptoms, like if it's a big fibroid, sitting on the bladder, always running to the toilet, or even fertility. Just those experiencing those challenges. Then you come to the diagnosis, and then they say to you, you got fibroids. What are the options? So we've just talked about natural options. So there are natural methods or remedies that many women want to explore, and which is fine. And on my channel as well, we have different videos that look at the natural methods. I've even got in the shop, and we're having discounts the whole of Fibroids Awareness Month. We have discounts on my fibroids treatment comparison tool, and that looks at the different fibroid treatment options and then compares them, so that if you're sort of wondering which suits me, which should I have, what should I do, get that tool, and that will just help you and put you in a better frame of mind and understanding, and help you choose the method that suits you, because one size doesn't fit everybody. And it is not true that if a woman has fibroids that she has to have a hysterectomy. In fact, that method will probably be reserved for women who have come to the stage where they finished having their kids. And because some people are surprised to hear that doctors are actually interested in preserving women's wombs. We are trained not to go for the most draconian option. We actually want to preserve a woman's womb. And apart from that, the surgery itself carries complications. So you don't want to go down in that direction unless you particularly have to. And the people that may have to are people who finish their families and, they are having very, very bad symptoms. So that may be why somebody would recommend a hysterectomy, but it wouldn't be the number one option. There has to be that, the other options are not suitable for a particular reason. And I encourage women to sit down and speak to their practitioners about this. So other surgical options, of course, are things like myomectomy. We have a video on the different types of myomectomy, why one type or one style is better than the other. The older ones, of course, used to use the typical, sort of cesarean section approach where the womb is cut and you want to withdraw the fibroid. That's probably less used now and only for very large fibroids, but it might be useful. Other measures like laparoscopy, that's keyhole, or hysteroscopy, they put a a device or the tool through the vagina into the womb to remove little fibroids that they can reach with that method. So those are the types of myomectomy that you could have. But apart from surgery, you have medication treatment depending on what is needed. It could be to control pain. It could be to try and reduce the size of the fibroid a little bit before you then have surgery. So making the fibroid, making the operation a lot easier. So surgery is not the only option for treating fibroids. And by the way, some people say, oh, once a woman has fibroids, she cannot have children. Well, let me spill the tea on this one. And that's why I encourage you to go and watch Dr. Tolu's video with me, which is on, I think it's Ask the Expert, I think is the title of that video or the thumbnail. And actually, in terms of fertility causes, fibroids take up a small chunk, 1 to 3%. When you go and sit with your gynecologist and you're worried about the fibroid affecting your ability to get pregnant, they're not going to quickly rush you into the theater to remove the fibroids. They're going to look at other things that could be causing fertility issues, because actually fibroids is just a tiny percentage of that whole causes of infertility journey. So we're talking about myths that are associated with fibroids, and we've gone through a few. I'm just looking at my notes. We've talked about an unhealthy lifestyle. We've said, no, that's not the case, because we have women who have very healthy lifestyles that get fibroids. We've talked about the myth of fibroids affecting only older women. And we said that's not true either. That yes, as women go older, you're probably likely to find fibroids more commonly in them, but they are quite common. In fact, more common in women in their reproductive age, because for some of the older women, some of them, their fibroids will shrink. Some, not all. So you tend to have it more in that middle group, that women still in sort of their late reproductive years, 30s, 40s, and so on. But younger women can also develop fibroids, even teenagers. So it's not true to say fibroids only affect older women. And then the third one we looked at was that natural treatments can shrink fibroids completely. I said that's not true. I'm a fan and an advocate of natural treatments, but I want you to be clear why you're taking them, how long you're taking them for, what is the impact, because a lot of them can be quite expensive. And if you're pursuing them because you want to try for a baby and you want them to shrink the fibroid, there isn't much evidence that they can do that. They may help to relieve some symptoms. And I referred you to my video on green tea vitamin D that showed some evidence of helping with symptoms and could help to shrink the fibroids. And I just talked about number 4, which is that surgery is the only option for treating fibroids. So if you're just joining, thank you so much for popping in. Hi, Black Messiah. So your question is, how are you doing? Hope you're well. Can you explain why studies in America suggest chemicals in hair relaxers cause fibroids? So, so these are endocrine disruptive chemicals. I'm just trying to think if I have a video on this. I think I do actually. So these are, so the chemicals, the relaxers, yes, the relaxers, hair products, and so on contain endocrine disruptive chemicals. And it is thought that they may disrupt hormone balance, because that's what endocrine means. It's talking about your hormones and the different organs involved in that. So these relaxers, cosmetics, hair products may contain endocrine disruptive chemicals that mess about hormone balance, and in that way could lead to fibroids. We don't have enough evidence yet. It's still something that, okay, let's be aware of this. More studies are needed. So I would be careful about this information, because the other question you ask yourself is, okay, if these relaxers and these endocrine disrupting chemicals are responsible for fibroids, then why isn't every single person getting them? And this is the thing about fibroids that we still don't know much about, that the cause is not just one thing. I'm not saying the endocrine disrupting chemicals don't play a part. They do. I agree they do. They could. But there's something in some of us, in certain women, something maybe in our genes, in our chromosomes, that increases our risk or likelihood to develop fibroids compared to the next woman sitting beside us using the same hair relaxer. So I think there's still a lot more work. I've come across these studies and reports, and there's a lot. It's good that we're having these questions. It's good that we're raising these matters. It's not to frighten us or anything like that. The evidence is not conclusive. That's my opinion. So I would love to hear back from anybody else, see what you guys think, or what else you've heard about that. Guys, please don't forget to like this video and subscribe to the channel. Please give us some support. Really happy with the engagement that we've had this last month. Thank you so much. So myth number 5, you will love this one. Myth number 5 is that fibroids always cause noticeable symptoms. So this is one that many women, okay, so the thing about fibroids is common symptoms of fibroids that, we know: heavy bleeding, heavy menstrual bleeding, sometimes bleeding that is very longer than you expect a menstrual period to be, pain with the period, pain without the period, pelvic pain. What else about the bleeding? That's one. Then the other part is the pressure. That is the fact that the fibroids are sitting in the womb. They make the womb bulky. And then the womb is now pressing against other organs within the pelvis. The pelvis, of course, is the small space. There's not much room there. And so it will put pressure on the other things around it. And what are the closest things to the womb? The bladder is right in front of it, and behind it is the rectum and the anus. So pressure symptoms can happen. And then that could mean constipation, not being able to go to toilet freely as you'd like, maybe feeling bloated because you can't empty your bowels properly, or trouble with your bladder, passing urine, going to toilet often because you can't really empty your bladder at once because the fibroid is pressing on it. Not a very comfortable thing at all for somebody. And then nerves, there are also nerves in that area. So the fibroid could also be pressing on nerves, and that's why a woman could have constant backache or even leg ache, depending on which nerves are being pressed on by the fibroid. Those are some of the symptoms. We've talked about fertility issues. Fibroids can have a whole host of symptoms. However, fibroids can be there and cause no symptoms, none. We don't realize somebody has fibroids until we do a scan looking for something else altogether, and there is a fibroid sitting there nice and pretty. So this is the thing, women have different ranges of symptoms for the same condition. There's some women who have fibroids and they have children. As you would know from watching videos and, with your knowledge about fibroids, they can be in different locations in the womb. They come from the muscle, but they might be pushing out into the outer part outside of the womb. So pushing into the pelvis itself, or they could be pushing in within the womb itself, or just sitting in the middle, in the muscle of the womb. And in those different positions, they can cause issues. Somebody could have just one fibroid and it doesn't do anything. Somebody could have one fibroid and it causes plenty of problems. Somebody could have 3, 4, 5 fibroids and they are sort of dotted around in different areas of different sizes and it doesn't cause any problem. Somebody could have 3, 4 massive fibroids. So it's, and we don't know why this happens, and it is such a mix of different things. But the myth is that fibroids always cause noticeable symptoms, and that's not true. So some women will not know that they even have fibroids, especially if they are small and they're not in a sensitive area. And it's good to say that fibroids that don't cause any symptoms, that don't do anything, we don't treat them, just keep an eye on them. They don't need treatment unless they're causing some trouble or some symptoms. Okay, guys, thank you so much for joining this stream. I hope you are finding some use from it. I hope, I'd love to hear back from you if you've got any comments or questions. My plan is to just keep this open for another few minutes before we close the stream, because I'm on to my last myth, which is that fibroids happen because a woman has never been pregnant or she's never had a baby. And again, this one you can just use simple. What's the word now? You don't even need reasons for why could this happen, why is this the case, before we even go to look for the medical reasons. This is evident because there are some women who have children and have fibroids. So that already tells you that that myth is a bunch of old, like one of my old lecturers used to say, a bunch of old cobblers is nonsense. So it doesn't have anything to do with the fact that a woman has never had a baby. But it is true that when we do the analysis, when you look at the analysis, you're likely to have fibroids happening in a number in women who've never been pregnant. When you sort of look at the numbers and sort of compare them, you will find that fibroids do tend to happen more in these ladies who have not had children before. And so that again makes us ask the question, what could be responsible? And it probably, when we're looking at causes, it probably pushes us towards hormones, balance of hormones here and there. But again, that alone is not enough to explain and say categorically that if somebody has not had children, therefore she's going to develop fibroids. So that's addressing that myth. So fibroids are a condition that we still need a lot of work to deal with, to still need a lot of research to help us identify what is responsible for these conditions. Thankfully, we have many different options. We need facilities that can support women with research, that can help us ask the questions that we need answering. We need practitioners that are sensitive to women's needs. We need quick diagnosis. So if somebody is coming up with abnormal menstrual concerns or pressure symptoms, yes, it's possible that they can mimic other conditions like ovarian cyst or IBS and so on. But when somebody has had these symptoms and they're coming back, it's not enough to just send them off with painkillers or birth control pills. Then we need to do tests to find out what's causing them. And my role is to help educate women to say, well, don't sit with this symptom. A lot of women feel isolated, but it's really important to say, please don't sit alone with this symptom. Do speak to somebody about it. Use our health information service, which is there to help point you in the right direction, so that if you have this condition or if you have this set of symptoms, we can say to you, I think you need to go and see your doctor to have this checked out because of XYZ, and here's what they should be doing. That sort of support, I think, is very necessary for many women, because one, they feel, oh, I don't want to go to the doctor because it may not really be important, or I don't want to bother them, or something, I don't know what. And our service is one that helps you put a spotlight on what you're experiencing and says to you, actually, you need to get this checked out, and this is how you present it, and this is what it could be, and get your practitioners to listen to you. Okay, so got a question, another question here. Can pressure on the rectum cause permanent problems? My fibroid is on the cervix. Permanent problems. Yeah, it can do. It's possible. So we have to look at the size of the fibroid to know whether it can cause permanent problem. Its position, because you could have fibroids that are in the back of the womb, within the muscle, and that's close to the rectum, but not really causing any problem. But if you have a fibroid that is the one type we call subserosal, so it's sort of growing outwards and pushing on the rectum, then it could narrow the space and it could cause problem with opening the bowel. And so this is one that should be discussed with the surgeon to see, is it something that they can remove surgically, or is it something that a procedure like uterine fibroid embolization might be useful? I don't know. I'm just dropping some thoughts into the mix. A scan or an ultrasound scan or an MRI would probably be in a better position to identify whether or how easy it is to access that particular fibroid, if it is responsible for the symptoms. Fibroid is on the cervix. So the location, yeah, it is possible, again, depending on the size. Because remember, the cervix is the neck of the womb. And so it's lower down. It's not in the body of the womb, it's lower down. And if it's large, it could push back against the rectum. I'm not saying definitely, because again, we don't have all the information, but it is possible that it could do that and then press on the rectum or anus. And like I said before, lead to problems opening your bowels because it's narrowed the space. So it's not as if you can't go to the toilet or not. Just imagine if you had a tube, a tube that's sort of a little bit blocked. So it causes a little bit of an obstruction. And so you want to go to the toilet, you want to open your bowels, but because the space is very small, you don't feel as if you can go, only small amounts will come out at a time. So you feel as if you're constipated. So that is a possibility. Yeah. 3 inches so far. Yeah, that MRI should be really useful. I remember you said this. I thought, yeah, that was wasn't it last week's stream? Yeah, so we're not at next month yet. Yeah, I think it is possible. It's well worth a discussion to see whether that's responsible for the trouble with your bowels. I think it's definitely worth it. Okay, guys, so we are at, I think we've, I haven't got any more questions, but I think I've covered all I wanted to say about the myths, some of the myths. And I would love to hear many more myths, because, women sit down at home and worry about it. Oh, there's one I didn't mention actually, which is although I covered it, I did cover it last time. So maybe not to waste too much time on that one. That's birth control causes fibroid, which that's a double-edged sword. There are different ways you can look at it, and there is evidence that yes, it can increase the growth of fibroids, yes. But as I said to you in the last live stream, that we have a study that suggests that it protects against fibroids in some group of women. But that is interesting. That's the way science is, isn't it? Guys, thank you so much for watching. Thank you so much for joining me on this stream. I'm going to shut it down now. Let me know what you guys think in the replay. Let me know any myths that you've heard or any other questions. Please use our email health information service, guys. It's there to help you navigate your healthcare journey, to help to clarify and just shed some awareness about things and help you get the right answer. Thank you so much for watching, and hope you guys have a great weekend, and I'll see you again soon. Bye-bye.